What is the Affordable Care Act? It is a comprehensive healthcare law reform. It addresses healthcare coverages, healthcare costs, and preventive care. The full name of the ACA is the Patient Protection and Affordable Care Act, and is commonly known as ObamaCare. It was signed March 23, 2010, and it is also 900 pages long. The law requires people, excluding those who qualified for a hardship or other exemption, to either have health insurance or pay a fine. It provides subsidies for middle-income families. It expands Medicaid to more low-income people. It helps small businesses offer health care insurance. And that information was from thebalance.com. There are 3 major goals. These 3 goals consist of make healthcare insurance available to more people, expand Medicaid program, and support the innovative medical care delivery methods. And that was from healthcare.gov. Key federal provisions. For the first one, expand access to insurance coverage. For example, require employers to cover their coworkers or pay penalties with exemptions for small employers. Increase customer insurance protections. For example, prohibit insurance plans from excluding coverage for children with pre-existing conditions. And emphasize prevention and wellness. Investments in health information technology. Promote health workforce development, meaning increasing in health professions, scholarships, and loan programs. Curb rising health costs, which emphasizes preventions, primary care, and effective treatments. State roles implementation, which is implementing new health insurance requirements to expand their Medicaid programs. I got the information from freelibrary.org. There are many pros and cons. Some pros are slows the rise of healthcare costs, coverage 10 essential health benefits, coverage for pre-existing conditions, children can stay on their parents' health care programs, there are no time limits on care, meaning insurance companies can no longer maintain a preset dollar limit on the coverage they provide their customers. More screens are covered, meaning covering screens and preventive services. For example, BD screening and early treatment may help prevent costly and debilitation treatment later. Lowering prescription drug costs. ACA makes prescription drugs more affordable. And some cons consist of raised income tax rate. The ACA taxed those who didn't purchase insurance, people who choose to pay tax rather than people for coverage. Then we got pharmaceutical companies had to pay extra for losing the donut hole gap. Enrolling can be complicated. Businesses are cutting employee hours to avoid covering employees. Businesses with 50 or more full-time employees must offer insurance or make payments to cover healthcare expenses for employers. Future ACA, meaning ACA changes every year. The legislation can be amended, and the budget decisions can affect how it is implemented. And I got this information from healthline.com. Some cost. From 2008 to 2017, there has been a major increase in insurance cost. From 2018, it was around $160 for the average individual premium. It had went up from 2017, $393. For the deductible for average individual, it was roughly $2,000, now up to $4,000, almost $5,000. For average family insurance premium, it was at $300, almost $400, now $1,000. For the deductible for average family, it was at $2,000, almost $3,000, now it's $8,000. So as you can tell, it had drastically jumped from 2008 to 2017. And then some extra facts. The real goal of ACA is to lower costs of Medicare and Medicaid. The ACA benefits the middle class more than the poor. The ACA subsidies go to the family that earns between $47,000 a year and $94,000 a year, or 400% of the federal poverty level. It also adds benefits to those on Medicare. It doesn't provide health insurance to illegal immigrants. You must get health care insurance for at least 9 months each year to be subject to a tax. For example, if you declare bankruptcy, you are exempt. And this information was also from thebalance.com. Women get important new benefits that they won't be charged more than men. For example, birth control is free, bone scans, pap smears, pelvic exams, colonoscopies. You can buy health insurance even if you're already sick, and you'll pay the same price as a healthy person who is the same age. So in the past, insurance companies would refuse to cover people with health problems that are currently who wasn't even on their insurance plan, and that just